It is easier and more cost effective to maintain good health than to regain it once it is lost, said the famous doctor and writer Kenneth Cooper. Hello, everybody. How is everybody doing? My name is Dr. Aswini Misro. I'm the innovation lead for YouDiagnose. I'll be talking to you today about YouDiagnose automation model for faster, earlier, and more accurate cancer diagnosis. The dilemma of high quality versus cost-effective healthcare is not something new in medicine. From hospitals to clinic to physicians to insurance companies, everyone in the industry has struggled with this challenge of providing efficient and high-quality healthcare at lowest possible cost. Now, though some of the improvement and innovations has been done in the past decade at a global scale, especially after the pandemic has accelerated the inclusion of technology in almost every industry, the truth is that the UK is far and away behind all the OECD countries in cancer care. And this has got major consequences. The fact remains is that the UK is both slow and expensive in terms of cancer diagnosis, and this has got major risks for the patients as well as the healthcare ecosystem. Let us review some data. Today, delayed and misdiagnosed cancer cases affect as many as 4 out of 10 UK patients. But this is just one side of the coin. The other side looks even worse. Research shows that 56% of cancer patients needed more than one GP visit before the correct diagnosis was made, while 15% required more than two GP visits. As a result, the referral rate kept increasing at 10% per year between 2009 and 19, while the conversion rate kept decreasing at 5% per year. So, what does this mean? This answer is simple. The cost of cancer diagnosis in the UK has gone up by 50%, and it has also become less effective, mostly because of the troublesome, time consuming, and inefficient process of manual triage in accepting the referrals. While addressing the issue has become a matter of urgency, especially considering that the elderly population of UK is predicted to grow at 19% per year. Now, since we have identified the problem, we are here to propose a solution to. In search for proper balance between the top class healthcare and cost efficiency, we have developed an alternate model of care based on a clinical decision support system powered intelligent automation of the entire workflow, starting from the referral of the patients all the way to the exit of the patient from the cancer services. This intelligently performs the triage and automation of the referrals, acceptance, etc. for suspected cancer patients. This saves time as well as money, both sides, that is, patients and the healthcare system. In layman term, this is equivalent to an AI powered NHS 111 services specifically designed for suspected cancer patients. Suspected cancer patients are provided with one time access to the triage platform that asks them simple questions about their current medical condition, their past medical history, family history, medications, past investigations, medical conditions, surgeries, lifestyle factor, demographic, and real world information. Based on the information provided, the system then analyzes and generates individualized predictions about their possible medical conditions, risk, urgency, and care requirement for further management of those conditions. That means no more unneeded referrals or wasted time and money on avoidable consultations. This is the example of some of the real cases which has gone through our system. As you can see here, this is a chatbot. This is a breast cancer patient in her 50s, who presented with nipple inversion, which was irreversible, and patient had uh, risk factors such as breast cancer in the past. So the system deemed it as a high risk case. The next is a case of skin dimpling, which was stable and it was there since very long time. However, the patient had history of breast cancer. Even though it was stable, the system deemed it as intermediate risk, requiring further investigation. This is a case of nipple discharge in a patient who is a smoker with multiple spot nipple discharge, and the patient had foul smelling yellowish discharge. Therefore, the system has deemed it as a case that requires urgent care from GP, and therefore the system has placed it as under the urgent category. The next case is that of a lady in her late 20s presenting with redness on the breast, not responding to antibiotics and fever. Therefore, the system has put this case as a possible lactational mastitis and for emergency care. This is a patient in early 30s presenting with cyclic mastalgia without any red flag symptoms. So the system has carefully identified that this is a low risk care condition which can be managed in the community with in liaison with the CP. This is a real-time view of our dynamic risk assessment and prediction model, and this is how it works. Based on the information supplied, the system generates a set of predictions and the risk profile and recommended further action. As we add more and more information, the dynamic prediction accuracy and risk profile gets updated. Clinical decision support system powered consultation can reduce the time spent in the information gathering process or the documentation by 62 to 75%. This leaves the highly pressured clinicians to spend more time in analysis, decision making, communications, and most important, relationship building with their patients. Smart care pathway management. Once we know our patients, we know where they should go and what type of care they should receive. However, rather than depending on a conventional manual process, we can our system can intelligently distribute the resources to the patients according to their care requirement. Here are some thoughts and ideas on how a national triaging system can be placed to address the incoming referrals on a mass scale. An objective, evidence based approach like this will empower everyone. Especially, we think such a system will help the community physicians who may not have access to a lot of investigations and therefore left to firefight with tough choices and decisions on a day to day basis. So rather than being perceived as a gatekeeper role, they can be helped with a clinical decision support system like this to provide care more confidently. This will also prevent our A&E from being flooded with inappropriate referrals and presentations. No two care facilities are alike when it comes to capacity, efficiency, and patient load. A smart clinical decision support system powered by AI can help to smartly distribute the resources and guide the patient flow evenly across the various care facilities available. This type of smart allocation can help the struggling institution with a temporary relief before they can institute definitive measures. Here are some of the distinct advantages and value clinical decision support system can bring to the entire region or country. Number one is direct to investigation pathways. A data-driven clinical decision support system can open up new possibilities for direct investigation pathways for primary care physicians and reduce the consultation burden on the secondary care. Furthermore, in times when individuals are getting are getting more capable of handling larger volume of the data and want a highly informed decision. Building digital medical profile at the outset can lead to medical consultations only when needed. This means that patients can manage their self-limiting medical conditions more confidently in the community. This will not only reduce the burden on the care facilities but also infuse cost efficiency into the entire system. Data-driven and evidence-based predictions will make cancer diagnosis and treatment faster, earlier, and more accurate, while opening the promising door for the future of the medicine, that is self-management or community management. As a result, smart allocation of resources guided by a data-driven triage will help to drive system efficiency and reduce the cost of operations while improving the diagnostic accuracy by various ways such as economies of scale, improvement of asset or resource utilization, and turnover. Given the diagnostic uncertainty, emergence of non-specific presentation of common diseases, we have partnered with like-minded organizations to exploit the next generation sequencing in day-to-day clinical use for the clinicians, for the frontline clinicians. And here is Mr. Tan Rasab, the chair of Harvard Genomics Committee.
Hello, my name is Tan Rasab. I'm the CEO and co-founder of Cygenics. Cygenics is a company based in the US and England. We are aiming to empower clinicians and physicians around the world to be able to carry out gene sequencing-based panel tests directly on site at the point of need rather than having to send the samples away to distant labs. With our platform, clinicians will be able to get answers together with validated reviews on specific genomic biomarkers based on their client's condition and be able to decide what are the therapy decisions they need to consider. Cygenics has partnered with YouDiagnose to bring gene sequencing-based tests for oncology throughout the world. With our platform, YouDiagnose is able to help clinicians carry out the tests, and with the technology which they have developed and the algorithms they have developed on their platform, the Cygenic tests can be then interpreted and diagnosis prepared with therapy recommendations for YouDiagnose customers. We hope this partnership will help us to expand and reach some of the areas that we are not intended to target initially, but with YouDiagnose's help, we'll be able to provide access to rapid gene sequencing-based tests at a low price throughout the world. Thank you.
Having completed the second leg of our model, now we come to the third leg of our third component of our model, that is learning culture for digital transformation. A disruptive technology won't see the success of daylight unless we create the culture conducive for its adoption. Here we have Lizzie Lowenstein, who has worked with companies ranging from reputed Fortune 500 companies to NASA and NATO.
Hi, Lizzie here for Investors in Learning. Now, Aswini has asked me to give you a brief introduction to how YouDiagnose and Investors in Learning are working together on bridging this divide between the best of digital and the best of human. So let me introduce myself. My name's Lizzie Lowenstein. I'm an organizational psychologist. I founded Investors in Learning in 2011, and I've been working in the field of applied psychology for around 25 years. Now, as I've been working on developing high-performing individuals, teams, and organizations, I've really come across the need to develop learning and continuous improvement again and again. So this is now what I've focused on, and I've created frameworks to support organizations to do this. So my expertise is around developing learning systems, learning processes, learning solutions, lessons learning, and also really looking at the human factors and engagement strategies for embedding sustainable solutions digitally, digital solutions. Because we very often miss this deliberate and intentional design behind embedding digital solutions, which is so fundamental. And this is really how YouDiagnose and Investors in Learning found each other because YouDiagnose is very, very keen on making their innovation sustainable, and this is exactly what we specialize in. So we build resilient learning cultures, and this is really a focus because, as we now know, culture eats strategy for breakfast, lunch and dinner. It is so key to any success. We have developed a continuous learning culture driving success framework. As you can see, leadership is surrounding this because the leadership narrative is essential. Now, the human elements sit in the center, the human factors have to be considered, and every organization needs to be looked at individually. There's no time right now to go through the details of this. I just wanted to show you that we have a framework which is very much focusing around sustainability. Now, in terms of YouDiagnose and Investors in Learning, we're developing an online digital system called Lessons Learned 360. And this is all about blending the best of digital and the best of human, ensuring that the entire lessons learned cycle is actually applied. So what happens very much in digital innovation is that, many people can resent digital innovation or can see it as people exercising control over them or almost manipulating themselves. So what we try and do is we try and create a bridge so that those that resent it are walking over that bridge to embrace the technology. But we need to work with people, not against people. And this is where the human psychology comes in. So any disruptive technology requires the building of an intentional learning culture. The learning culture and embracing of human factors helps to build that bridge, and the humans are the ones using the digital innovation, let us not forget. So they're the ones who go in, and they need to want to be there. They need to enjoy it. They need to embrace it. And without that also, we don't get the inclusivity, the equality, diversity, inclusion agenda is so huge when it comes to digital innovation, which is, again, of course, a really, really big consideration. So what Lessons Learned 360 does is it makes sure that digitally we are guided through the whole lessons learned cycle, which goes from observation to analysis to lessons identified, then turning the lessons identified into corrective or reinforcing actions. Then lessons learning is actually the application of this. This is what humans aren't very good at. And then the monitoring and embedding the sustainable results and the behavior change. Humans are even worse at that. Hence, we're building the system to help humans to be guided digitally, and also where the data can be recorded. So this is just to skim it, because of course this is only very, very short. There's 5 phases: observe, analyze, lessons identified, plan, and lessons learned. This Lessons Learned 360 system, best of digital, best of human, takes you through that entire cycle, making sure that humans are actually following it and taking through the phases. And this is where YouDiagnose and Investors in Learning are working together to make sure that the YouDiagnose technology is really using best-in-class solutions. So sorry, this has been a whistle-stop tour through some very complex things, really. So I hope this has made, comprehensive sense to you. Please do feel free to get in touch with me. I would love to discuss any of your questions. And thank you very much for listening.
The fourth component of our model is to promote inclusiveness and reduce the digital divide. Roughly about 10 million people in the UK are not confident in using digital pathways because they do not have the digital literacy or the motivation to use the digital pathways. To include them, we have partnered with MPM Healthcare, which has got the in-house expertise for healthcare call center management and counseling for various medical and mental health conditions. Unfortunately, we do not have MPM Healthcare representative to provide their side of the story. However, I'm more than happy to provide the brief on their behalf over email. Our real-world validation study was due to start at East and North Hertfordshire NHS Trust this year. Due to various competing priorities, of the trust, we are unable to pursue it any further. And this is why we need your help to move forward with our mission. We are looking for a forward-looking NHS partner organization which has the clinical interest and the management support to pursue digital innovation and digital adoption. By contributing to our cause, you will not only be contributing to a major development in healthcare efficiency, but also you will receive a host of benefits from us and our network. It is said that a life is not important except in the impact it has on other lives. We are inviting you to create an impact for building a more sustainable healthcare systems in with an improved patient flow and cancer care management. As we know, risks are always associated with any innovation or improvement project. But I am very confident that by working collaboratively and fostering the spirit of innovation, we can manage to turn that risk into opportunities. This is a huge opportunity to create an alternative model of care. Don't miss it out. I'm sadly not available for personal meeting with you today due to unavoidable circumstances. However, I'm reachable over my email address if you have any further queries. Don't hesitate to get on board. We count on you. Thank you very much for your attention.